So what made me decide to become a physician? When I was in high school, I took a lot of biology classes, like physics, anatomy, and different things like that. And I just loved those classes, and my mom's a nurse, so she was, told me, why don't you come to volunteer here at Walter Reed, where she worked. And I would go there, and I actually got to shadow a lot of different doctors. I got to shadow dermatologists and emergency medicine doctors and physical therapists. And I was just kind of in awe on how they were making these diagnoses and how they were prescribing these medications. And I just got very interested in everything that they did, and I just decided from then that I wanted to be a doctor. So I selected rheumatology as my specialty because I didn't really know initially what I wanted to do when I first started as a first-year intern. But when I was doing my internal medicine residency, I found that all the cases that were interesting happened to be rheumatological. All the lupus cases where we had patients with maybe CNS lupus involvement or involvement of the lungs or heart, or really bad skin rashes, like all of those cases turned out to be rheumatological. And I thought, wow, this is very interesting. This is so unique, and this is something I really want to do more research in and probably pursue this as a career. One of my favorite job satisfaction stories is a patient who I saw just recently. Actually, she came in with a lot of pain in her back, in her shoulders, in her legs, and come to find out, we did some blood work and I did my physical exam, and she had pretty much classic symptoms of a disease that we see commonly called polymyalgia rheumatica. And I was able to start her on treatment pretty quickly, and she was starting to feel good. So it was very satisfying to know that, after months of searching for answers, we were finally able to diagnose her, and she felt much better after treatment. I actually really love having a good, strong connection with primary care doctors, especially when I see a patient for the first time. I like to sometimes call the doctors and reach out to their primary care doctors and talk about my diagnosis and kind of go over the other diagnoses the patient has so that we can come up with a plan together. And I think it's really important to connect with primary care doctors all the time, and that's why in our practice, and what I like to do is every time I write a note on a patient, I send it to their primary care doctor. And this is usually after follow-up visits, after their initial visit, so that their primary care doctor is kept in the loop about all the treatments and how their patient is doing.